Welcome back to the Following Your Gut podcast, where health science meets clinical wisdom. I know someone out there, be it yourself or someone that you know, has been at the mercy of the medical system's inability to elucidate a causative factor for one's illness, disease presentation, condition, what have you. And it can be a very, very challenging thing because once you've gone through the gamut of practitioners and you have no answers, where do you go to? Well, the guy I'm interviewing today, I have the pleasure of calling a mentor, a friend, substitute dad figure, compadre, whatever else you want to call him. And he's known as the guy that people see last on their journey because he's made a career of fixing what he calls failures of the medical system. So, with pleasure, I want to introduce Dr. Jeffrey Marrongelle to the podcast today, a homotoxicologist, biomedical or biological medicine practitioner is a better way of putting it, chiropractor, and more. So, Dr. Jeff, how you doing?
Roland, it's a pleasure to be with you on your podcast today to address some of the issues that are facing all of us in America and around the world, but primarily here because um, we spend more money on healthcare than any nation on the world. It is over 10% of our gross national product. Somebody should do the math because we will be later talking about math. And we are not even close to being the healthiest nation. We're not even close to being the healthiest nation on earth as we should be. Okay. And so I've been in practice. I started as a chiropractor in 1987 when I graduated. And within a year, a friend of mine from Lancaster told me about a doctor in Ohio who was doing some work, and people were going out to see him by the busload, literally. And he said, "Let's go see what this guy's doing." And so, I was just a straight up garden variety chiropractor at that point, doing some advanced work in biomechanics, and we went to see this clinic, and the head of the clinic was also a chiropractor, but he had studied electroacupuncture, according to Vol, and biological medicine and homotoxicology in Germany. And this was the majority of his practice. He had a physician's assistant working for him. He had a nurse practitioner working for him. He had um, a now renowned uh, pharmacist working for him who was into homeopathy and complex homeopathy formulation, et cetera, et cetera. We became and still are lifelong friends. And both of us, our careers and our stature in this space has grown. And frankly, it's because we were early adopters. And when there's only less than 20 people in the entire country doing what you're doing, it's not very hard to go to the head of the class. And, we went to and organized many of the early conferences in electroacupuncture, homotoxicology, biological medicine, nutritional intervention, et cetera. And I came back from that trip and I told my wife, I saw something out here. I'm going to buy a piece of equipment. At that time in 1988, the first EAV device I bought was an Intero. It cost $11,000. That's probably about 50 in today's, you know, dollars. I bought a piece of equipment I didn't know anything about to begin understanding the practice of a whole area of knowledge that I knew even less about. But I was determined when I'd seen it that this was the future of um, human health care. I won't even call it medicine because it's not medicine. What we do is not medicine. It's as far from removed from medicine as is possible. We find causes, we um, support the biology to recover from either a toxic burden, whether it's microbial, like bacterial, viral, fungal, etc., whether it's chemical or heavy metal. Um, Whatever the toxic burden is, we try to isolate it and see how deep it's gotten into the body and how many organs it's affected and how severely. And the principles of homotoxicology um, lay that out in a very elegant manner, tracing the first reaction left untreated over time down a continually descending sequence of signs and symptoms until they become what we then diagnose as a disease because the body has failed to adapt, failed to adapt, failed to adapt over time, and no one has intervened to restore the adaptative mechanisms of healing, repairing, and cleaning. And and so we find people where we find them managing symptoms with drugs that do what they're supposed to do to the target organ, and the rest of the biology, good luck with. There are no side effects from drugs. I first want to say that there are only effects. Okay, the effects that are unwanted are listed as side effects, but they are direct effects. They are an attempt by the biological system to deal with a noxious chemical or an overdose of um, some sort of milieu of chemicals that have entered the system, and the biology has never seen them in nature or in food or in anything else. And so it has to act in a certain way. And so here we are 40 years later, um, intense advancements in technology, in pharmacology of complex homeopathy, uh, molecular nutrition, and high quality, high delivery phytonutrients, and well researched. Um, I don't like the word nutraceuticals because it ties one thing to another that don't belong together. Okay. Nutrition isn't suitical in any way. It is a molecular insert to a metabolic pathway that's been overwhelmed or is deficient or whatever. And so, of course, my way of thinking is certainly not mainstream because we work from a foundation of pure physiology, pure science, okay, and bioenergetics and biophysics. And so we work with the foundational physiology of human beings, knowing that the biological imperative of life is to survive and to recover, to heal and repair. All those biological systems are in place within us. And the greatest drugstore in the world is inside our bodies.
Mm. That's actually very profound. I think people need to realize the things we take aren't what help fix or cure us. They allow the body to fix or cure itself, providing the inputs are correct and the body has enough energy to adapt and heal.
Absolutely. And what I've been seeing lately in, let's say, a lot of LinkedIn posts, because it's mostly from professionals and so forth, uh, a turnaround from the pendulum that swung to um, you need to take this supplement and that supplement, and this works on that, and that works on this. And I see people coming here with a basket full of supplements, and they um, they I call them prevention magazine patients. Anything they read in the original, health nut publication was Prevention Magazine, and amazingly, they're only about 3 miles from my office here at the Rodale Institute. Okay, they still publish a lot of health work, and they pioneered the idea that supplements and nutrition was a natural way to live and a good thing to do. But that devolved rapidly into people using the medical model of this for that, and saying, here, don't take that drug, take this supplement. Don't take that medication, take this herb. Okay. I call those folks green MDs. They switch something that's pharmaceutical for something that very often contains the same molecule as what is in the pharmaceutical, because almost all pharmaceuticals are derived from nature and are poor imitations or isolates out of plants and herbs and minerals and so forth that were found in nature. And so, um, you know, being a green MD is not an evolution in or a revolution in healthcare. Health and well-being requires personal responsibility and an understanding of what did I fail to adapt to originally, and how can I recover back to where I was before I had this overwhelming infection, exposure, mental, emotional trauma, physical trauma. And we are seeing now with the burden of um, what are called POPs, persistent organic pollutants, in our environment and in our food chain, that everyone has a burden, a biological burden of toxicity, coupled with electromagnetic fields and electrohypersensitivity, and being bombarded by waveforms that, if you could see them flying through the air, would look like smog thicker than the heaviest fog you've ever been in. Because all the waveforms, when you pick up your phone and you can find 20 Wi-Fi signals, yeah, maybe you can block, one and deal with one in your living space, but the other 19 that are flying through your space that you can't control from other people's equipment and so forth, are increasing your exposure times 20, 30, 40, 50 times, depending where you live.
It's scary for
This
people
is
who live
never
in a condo.
calculated into the equation of health and well-being anymore,
Hmm.
because it is the asbestos of the modern world is electromagnetic stress. And so, how do we deal with these things, and what does it damage in our bodies, and what does it deplete us of? And those are some of the things we're going to address today. And so, when I tell you I've made a living on medical failures for my entire career, it's a fact. In 1991, I filled out my last insurance form, and I've been 100% cash, 100% referral since 1991.
Yeah, I have a question for you.
Yes,
How do
sir.
you define a medical failure personally?
There are people that have tried numerous diagnostics and therapeutic interventions, both medically and alternatively, sometimes with functional medicine doctors, sometimes with acupuncture, sometimes with naturopaths, sometimes with chiropractors, sometimes with holistic health coaches, whatever it comes down the road. They've been grasping at straws very often for years. And I have a prime example of one that walked in. That's a gal who's been sick for 40 years, and no one even deduced the obvious. And I'll tell you that story in a little bit. But um, And so they wind up hearing about me and they go, well, what does this guy do different? Well, I'm going to look at all your medical imaging. I'm going to look at your blood. I'm going to look at what was done to you. Um, I'm going to see what treatment protocols and blood tests and stool tests and all kinds of other alternative and or not mainstream examinations have been made. And say, okay, that's all nice. Why are you here? If any of this stuff worked, why are you here in front of me? If your physician and the medical model work for you, you shouldn't be here. If all of your alternative practitioners and the medical model didn't work for you, why are you here? Well, I heard you do stuff differently. And yeah, I do, because I work on foundational physiology. I don't care about the disease model. I don't care about the notions and potions that a lot of people in the alternatives market have. And I may offend people because I'm neither fish nor fowl. I don't have one foot in one side and one foot in the other side of the fence. I have my own pasture that I live in. Okay. It's a whole different paradigm of thinking. It's a way of thinking. And um, foundational physiology relies on foundational materials. So what are they? Well, what is the most essential nutrient for life? What can't you live without? Everyone can't live without what? One thing.
Oxygen, I'm going to say.
Oxygen is, you get about 3 or 4 minutes of oxygen deprivation and you're out. 5 minutes, you're comatose. 6 minutes, there's a lot of loud singing and slow walking, and they're calling the coroner. Okay.
Mm.
So hypoxia is what everyone dies of eventually, regardless of what causes hypoxia. Uh, but breathing, oxygen is a foundation of life. And second to that, because it makes up 75% of our water of our body and 80% of our lungs, is water.
You gave it away there by mistake.
I know I did. I gave it away. Okay.
75% of our water is, oh, nope, that's not it.
Wait. 75% of our body
You
is
need a
water.
glass of water. Maybe you're dehydrated.
75% of the planet is water. Okay. We reflect our environment. And and so we do foundational physiological measurements now that, when put together in the correct formula, can give people much more power over their own destiny at home for low cost. And so I'm basically semi-retired from my private practice at this point and accumulating and training a private AI assistant and feeding it our own information that we've garnered over 40 years, refining it with the large language model AI, and creating a space where people can get valid scientific information that is referenced and repeatable regarding their physiology and their wellness. And I'm motivated in great part by the loss of my long-term friend and colleague, Dr. Gregory Ellis, PhD in physiology and exercise physiology. We worked together for a lot of years, and he passed suddenly. And through his executrix, his daughter, I acquired his entire physical library and am housing it. And we are now scanning and putting that into a searchable database. It's an incredible body of knowledge going back to the 1900s. Okay, he was a voracious researcher and hunter of information,
Mm.
and any type of exercise physiology, body work, how to, he's written multiple books, which we will be putting up on our AI biophysics website for to support his memory and his family. But this body of knowledge and what Greg taught me as we worked together was a blend of physiology and how the body works at the cellular level and at the subcellular level, combined with homotoxicology and biological medicine. And just for fun, we got to work with multiple world-class waveform physicists and learn about the physics of our biology. And so long before people were doing photobiomodulation and subtle energy work and so forth and so on, we were doing it with people who could measure it at the level of a physicist. And that goes back into the 90s. And so we've come to a point where my practice today is to deal with the foundational issues of our physiology that are being decimated by our modern life and by our exposure to multiple things. And so after oxygen and water, the next most critical level of depletion and deficiency that I see that impacts our biology the most is enzymatic insufficiencies and management of the microbiome. We have in and on our body about 3.5 to 5 pounds of microbe, yeast, molds, bacteria, viruses, cell wall deficient things that look like dust bunnies in your blood. They're on our skin, they're in our throat, they're in our mouth, they're everywhere. And they outnumber the cells of our body. Various folks, you can look it up, and that's what
Some people
everybody's
say
used.
10 to 1, some people say 1.3 to
Nine to
1.
one. It's some say nine to anywhere, somewhere between 8 to 1 and 10 to 1, but they sure outnumber us by a bunch.
Yeah, especially
And
their genetics.
yes, and our reality is the reality of our biology is we are in great part a slave as a host to these microbes, and their relative levels in our microbiome dictates very many of our activities.
Mhm.
They are energy, our neurology, our digestion, our psychology. Okay. We are seeing that changing nutrition alone can affect psychiatric disorders and psychological disorders, okay, behavior disorders. We see that changing, adding in depleted nutrients like magnesium or B12. We knew in the middle 90s that people with senile dementia, Alzheimer's, whatever you want to call it, that if they were replenished with B12, and I'm talking injectable B12, for about 30 days, about 60% of them would improve significantly. The problem is we had no definitive way to measure out of the 100 people who were the 60 that would benefit. So it's a cheap intervention, one of the first lines of defense for older folks when they're starting to have a little bit of a backslide would be to do some supraphysiological B12. Well, you can't get B12 injections unless you have pernicious anemia or some other medically diagnosed condition. And so, without third party pay, the vast majority of people will go without because they'd rather pay $90,000 for an automobile than $100 a month for B12 shots. It's the priorities of people that um, make them sick and keep them sick. And so personal self care is a huge part of our messaging to people.
Mhm.
So, you know, so let's come around to how we wound up doing this particular podcast. And
Well, you mentioned something I wanted to quickly touch on, if you don't
then,
mind. You mentioned enzymatic deficiencies, and I'm going to go ahead and assume that if you're listening to this podcast, you understand that we're big into enzymes, being master supplements in US enzymes, number one. And the second thing is from going through a variety of different lectures and whatnot over the last few years, we've learned that enzymes are the workhorses of the body. And I'm really excited to ask you about this because you mentioned homotoxicology and biological medicine. In
yes,
the Western world, the North American Western world, those really aren't things that people know. They know functional medicine, they know naturopathy or naturopathic medicine, but most of your training came out of Germany, some stuff out of Eastern Europe, Central Europe, and they're big in enzyme therapy over there.
very
It's
much so.
been slower in North America. Now people, because of long COVID, are starting to catch on to nattokinase. But most people think digestive enzyme when they think enzymes or enzyme therapy. You were mentioning that you see issues with health because of enzymatic deficiencies, which are intracellular enzymes, but you have had a huge amount of success using systemic proteolytic enzymes in your practice for various
Oh,
interventions, correct?
absolutely.
So the
Because of,
first question I
yes,
have is why has enzyme therapy been so big in Europe and been so slow to catch up in North America? And the second question is, what do you find the most effective targeted use of enzyme therapy is clinically?
okay. Now, I know you guys are hosting this, but a history, a little bit of a history,
Yeah, let's do it.
long before this company existed, of enzymatic therapy um, bears, if we don't know the origins of things, and when there was only a thing, there was only one premier enzyme when I began doing this work.
Was that
Okay,
Wobenzyme?
it was Wobenzyme.
Yeah, it's when the
Yes,
horses and carriages pull people around roads, right?
yes, it was. Let's think. Let's be kind over there, okay? But yes, okay. Um, and when um, when I began doing biological medicine, um, now I have to tell you that Greg and I were huge proponents of solving a particular problem that had to do with mineral metabolism. It had to do with magnesium potassium metabolism. And we actually did solve Labort's problem, and that's a discussion, for another time. However, of the 300 plus known enzyme pathways in our metabolism and our energy producing pathways with mind numbing long makes that the acetyl CoA and the Krebs cycle
All the
and
stuff
all
people
those other
forget when they
things.
leave medical school.
They didn't even know it when they didn't forget it because they never knew it.
Never
They
learned
barely
it.
got through. They never learned it. Okay, but I lived there. Okay, and activating energy systems, mitochondria, um, electron transport, proton generation, which feeds into this. And I'll get to the reason that proton pump inhibitors are so um, negative to the biology is that they are not targeted just to the organ that they're supposed to work on, which would be, gastric epigastric dysfunction. All right, proton pump inhibitors inhibit the protons movement all over the body, and that affects energy. It affects so many things that are a little heady to get into. But let's get back to um, magnesium and its influence on enzyme systems. Um, the metalloenzymes, there's an entire body of work called oligotherapy where one employs the free ionic forms of elements off the elemental chart. I am going to spin around real quick because I am in my office. And it's in 3 steps.
I'm gonna have to describe it to everyone because this is
Right?
audio only. So you're
I'm
holding up
sorry.
the periodic
But
table,
so we have
which
a
you've
copy of the
thrown at me in
periodic
clinic
table.
before and said, "Figure it out." Might I remind you?
Yeah, exactly. Here you go. So yeah. So anyway, Mendeleev figured it out, you could too. So the metalloenzymes require free ionic minerals to be in a certain place for the enzyme system to work. So zinc, cobalt, nickel, magnesium, calcium, iodine, all of these foundational physiological minerals need to be in a certain place. Well, the chemicals and the pesticides and the so forth and so on that we have in our food and in the air, and the aluminum we're being inundated with and the barium and so forth displace good minerals, and so they disturb enzyme systems. I'm of the opinion right now that after oxygen and water, clean water and highly energized, stable water clusters in the body, um, we need foundational minerals and we need enzymes. And I think almost every single person over 35 to 40 years old, and we're hitting into your zone. I know in my zone, the pickleball generation, the boomers, we all need enzymes because what are we finding now? All the functional medicine guys who kind of moved a little to the right or the left, depending how you look at it, they moved away from the straight school medicine. In German, we call it Schulmedizin, school medicine, what you learned in school. Okay. They moved away from that into more functional metabolic type medicine. And what are they finding? Sentient cells are a big problem. Cells that don't want to die, cells that aren't, they're just kind of lingering around and they're not getting, their cell walls are thin and they're creeping around our body, but they just don't want to quit. Okay. Well, when you get robust systemic enzymes, they help them out the door. Okay. They help them break down. They get rid of cellular debris just from living. Every day we break down millions and millions of cells. They need to be recycled. Red blood cells live 120 days, which means every day, 7% of your red blood cells die. They die. What do you do with them? What do you do with their cell walls? What do you do with their bilirubin? What do you do with their ferritin that's inside there? What do you do with the hemoglobin? Okay. Where does it go? Well, it goes through the spleen and it goes to the liver, and parts pieces go out through the kidney, and parts pieces of the DNA and RNA actually may fit into a whole nother model of what a virus really is.
Mm.
Okay. In our way of thinking, um, parts pieces of old DNA and RNA that bioaccumulate can act as a toxin, and they
Mm.
need to be eliminated. Can we pause for a second?
Mm.
Right. And so when we look at the metalloenzyme systems and how they're disturbed by our environmental influences today, what gets them? Persistent organic pollutants in our food, persistent organic pollutants in the air, the influence of electromagnetic stress, 5G, all sorts of cell phones and so forth and so on, the things that never existed before. Basically, microwave radiation that never existed on the planet before. And it disturbs the ionic exchange, more especially of calcium and magnesium at the cellular level, and it's well documented in the literature. But even more so, the way to neutralize it can be done passively and over a long period of time using appropriate intervention. And I'd like to discuss that with
Right.
you.
So just to round this out, Jeff, you're saying that there's an incredibly underappreciated role in all forms of healthcare in regards to the importance of enzymes and the functional aspects that should be common knowledge for practitioners to understand the interconnection between mineral dependency and enzyme function, because we talk about that all along. It's one of the reasons why our products contain astrozyme, which is a mineral rich trace mineral specifically, because you mentioned micro and macro minerals, but it's the trace minerals that seem to be the cofactors for enzyme function. And you're saying that there's a whole bunch of environmental insult, be it POPs, as you call them, persistent organic compounds or
Pollutants.
pollutants, thank you, electromagnetic stress, and then obviously, who has a healthy gut nowadays? Most people have a toxic influx into their bloodstream every time they eat food, regardless of what kind of food they're eating. So this is all perfectly overlaying a lot of the messaging that we've been talking about for the last 5 years. The hard part is the practical intervention piece, meaning, okay, we can talk about this stuff and how it happens and why it happens and the process. People want to know what the heck to do about it. So, why don't we go there next? Because you have a very unique approach for deciding how products are used for people, but even also looking at things that you see successfully that products do for people that they might not associate with. You have some enzyme formulas that you really love and some other master supplements. Actually, you're one of our biggest accounts ever. Why don't you start with that story? The first time you ever came across your
Okay,
products.
I will because um, I was introduced to master supplements in US enzymes by Larry Stout, your regional sales manager for the East Coast here, who I've known for well over 30 years. I knew his mother and dad and his sister. I taught his sister how to do EAV and homotoxicology at their little health clinic that served primarily the Plain community of Amish and Mennonite folks in Lancaster County. And they were very, very successful with that for a long period of time. And Larry got involved with uh, he was a great salesman. And so he was doing sales and service for another company before he came to US Enzyme. Um, and we had always worked well together. And so he brought me US Enzymes. And as this is late in my career, this is probably 4 or 5 years that I've only been working with US Enzymes as a product line. And I'm like, yeah, okay, I'll give him a try. And he gave me a test kit. And it was very interesting the way he did it. He knew me for so long. Um, he gave me small jars. They all looked the same. And he put the name of the compound or the supplement on the inside of the lid. So I had to unscrew the lid to see what it was. And he knew that as an EAV practitioner, doing electroacupuncture and testing things across a test plate, according to Vol's procedures, that I would blind test these supplements that he gave me. And then I would find out which one the person wanted. I would take two at a time, put them up, and see if they resonated to the person. And then I'd take them off and I'd open the lid and go, oh, look, it's this. Oh, look, it's that. So within a very short period of time, and then I had enough, there were enough, maybe like 15, 20 of each supplement in these little jars that he gave me as my personal test kits to be able to give somebody one or two have them take them, let them get into their biological system, and then go use a biometric to see what happened to them. And my major biometric is ECG based RR interval heart rate variability, which you're well aware of and have talked about. And so I would do a nerve express before I'd see somebody if they were breathing. So for years, the reason I have the largest database in the country of clinical HRV is because if you walked and breathed and came into my clinic, every single time the first thing that was done was a heart rate variability assessment. Lying down, standing up, Valsalva maneuver, deep breathing, we had data. We saw what your autonomic nervous system was doing and how it was controlling your heart and how much vitality you had. This examination is a predictor of physical fitness and risk of sudden cardiac death. So it's a serious predictor. And that's not me saying that. That's Columbia Presbyterian Halter Research Center saying that, and Dr. Thomas Bigger, MD, saying that. Okay. And so I embraced and used this for years and years and years. And I started to see radical improvements in my patient using an intervention that was previously unavailable to me. And you mentioned the Astrozyme. And the very first thing that I said to him is like, you know, this base is anti-radiation. The foundation of every one of your nutrients blocks or helps minimize the impact of radiation on human physiology. So I want that. And so I used them for about a month, and I was on vacay, and it was getting near the end of the year. And I decided I'm gonna be like the pig at breakfast, okay? You know, if you're having ham and eggs, the chicken's involved, but the pig's committed. Okay. And I decided to get committed. And so I remember this because I was on a golf course in Arizona with my son and a couple other guys, and Larry called me and said he had a great introductory offer for me. And my very first order was over $14,000 worth of product
You
because it
ordered the
was
entire product suite, basically.
I did. I ordered the entire product suite in huge volume. Okay, knowing that becoming the first quarter of the year, I would go through that stuff because I was already had used it for a month or two and was ordering every week and couldn't keep it in stock. Why? In an established practice like mine, to find that the missing link to my biological medicine was high quality enzymes and biologicals that dealt with the entire system was revolutionary. Because over at that point, we were talking about a 35-year career. I'd seen every product from every MLM and every you name it come across my test tray. Oh, there's a new panacea, and here's a new best thing. Here's the flavor of the month, the flavor of the year, whatever it was. And so my my mantra is, when you're jaded and faded from seeing every kind of notion and potion over 35 years, you don't embrace things easily
Hmm.
unless they really move the needle. And when they started moving the needle significantly on patients who were already under my care, well, I'll tell you what, I sat up and I noticed because it filled in a huge missing link in my biological care that no other previous product line or product itself had done. And trust me, I had tried them all
Hmm.
and seen them all, from Enzyme to you name it. Every major producer of enzymes, every claim made by other enzymatic companies, et cetera, et cetera. I tried them. And there were some good ones out there. but there were never any great ones. And when I started using US enzymes and began to see the results on the physiology of my patients, it was a huge wake up call. I am not 100% certain about what created the influence, but it is measurable and reproducible. And I believe it is a combination of the perfect storm of micro minerals to activate enzyme systems, enzymes to fill in the blank for what has been depleted from the body, or is the body has insufficiency of production of certain enzymes and metalloenzymes, coupled with several parts pieces in the product line that passively remove persistent organic pollutants and toxins from the body when utilized slowly over a long period of time. What always was a mystery to me in the application of medical pharmaceuticals was that they were often used as a band-aid, like to control and monitor, or not monitor, but to manage symptoms,
Like a
which is
cholesterol
what,
medication, for example.
yes, what they claim, right? And so you would think they would have a limited span of use. The reality of prescribing pharmaceuticals is that once you're prescribed a pharmaceutical, you're expected to take that pharmaceutical for the rest of your life. And it is expected by some sort of weird mystery of the universe to always work the same way over an extended period of time. Now, the biochemists and the pharmacists and everyone knows that that is not the case. That eventually you burn out pathways metabolically, you bioaccumulate unnecessary quantities of material that you can't use and no longer use. They never take a break. They never change dosage. It's it's a ludicrous model that flies in the face of how our biology and how our physiology works. And for that reason, I reject it wholesale. It is wrong-headed. It is wrong according to physiology. I don't care whether you went to Harvard or Stanford or Yale, or you are from Columbia Presbyterian or Johns Hopkins or Scripps or the Mayo Clinic. It doesn't matter to me. I don't care. You're all singing out of the same hymn book, and it's the wrong hymns. Okay, so I will stand on human physiology and human biology as the foundation of health and well-being, and symptom management and care and treatment. Yes, is medicine a valuable thing for acute care, for traumatic care? There are huge benefits that no one in integrative or alternative medicine can begin to accomplish the level of trauma care that modern medicine has evolved to. It's incredible. But when it comes to chronic disease and chronic health management, huge failure. No one wants to hear that. The
Mm.
functional medicine guys don't want to hear it. Certainly, the medical establishment doesn't want to hear it. I don't care. Right? I'm not a rebel because I'm not out there preaching it to everybody else. You want to get with the program? Fine. You want to take care of yourself? Fine. You want to be responsible for your own actions? Fine. We'll teach you how. You can take a blood pressure cuff, a pulse oximeter, a couple $100 body composition scale, plug in those biometrics into a formula that we've evolved into, and you can get your risk assessments across the board over time much better than any wearable goofy biometric thing, is an Apple Watch. Are they practicing medicine without a license? Is a Whoop or an Aura Ring or any other evaluation of physiology that's out there, whether it's accurate or not, practicing medicine? I don't think so. They're monitoring to a degree that they believe in the physiology of the body. You know, are you not allowed to use a blood pressure cuff at home and assess yourself every day? I have an 80-year-old guy doing his blood pressure, pulse, oxygen, perfusion index, and respiratory rate 4 times a day for the last 4 months, as we slowly had him wean off of a very negative um, impact pharmaceutical for him. That wasn't working in the first place because it was not affecting the appropriate thing. I don't know if you know, but I'm going to tell you right now. If you multiply your pulse times your systolic blood pressure, it's a thing. It's called RPP, rate pulse pressure. It tells you about the oxygen consumption of the left ventricle of the heart. I've taken these metrics and evolved them, what I think is a very elegant way to monitor your own physiology at home, and then coupled them with my partner's body composition assessments so we can take your lean muscle mass and see how much oxygen that consumes. And we now have a metric that you can do at home that is far better over the long haul for predictability of your physiology and your risks of having morbidity and mortality than any exams that you're going to get at the local hospital, because they take a snapshot and you're at home making a movie of your biology. And we're going to be rolling that out this fall. We're very close to, to doing that. But let's get back to where we started. Moving into using so many of the different products from US Enzymes and Master Supplements, began by observing their impact on physiology that was measurable, hugely measurable. And why? Well, the vagus nerve, which controls all of our organs and systems, and it's getting a lot of play today. People are starting to understand what the vagus nerve does. It is the parasympathetic regulator of the human body. It is the relaxing, it's the brake pedal for your physiology and for your heart. The adrenal glands, epinephrine, norepinephrine, cortisol, and the brain can stimulate the heart rate upward. The parasympathetic nervous system, the vagus nerve, and the brain can relax the heart. And so the vagus nerve is obligatory to be a brake pedal, and the adrenal glands are obligatory to be the gas pedal. And the brain, the neurology, modulates between the two. And it is a constant flow, literally on a beat to beat basis in our heart. Now, our heart begins beating at 21 days in utero, is the first functional organ of the biology. And it stops beating when we stop. And so the rhythm of life is the heart rate. And then the second rhythm of life is the respiration rate. And the third rhythm of life is our brain waves: delta, theta, alpha, beta, gamma. The 5 brain waves from 0 to 5, 5 to 10, 10 to 15, 15 to 20, and 20 to 25 hertz cycles per second, or the 5 major brain waves. And what we're seeing today is a blunting of the nervous system by environmental stress and by television and so forth and so on to put people into a high delta state most of the time. And so people are walking around in chronic inflammation, and the brain is trying to reduce that inflammation and help counter regulate the adrenal glands. And it is making us dull,
Sleepwalkers.
somnambulant, half asleep.
Mhm.
Okay. Not because we're getting Alzheimer's, not because we're have chronic fatigue syndrome, but because we have silent and active inflammation going on in our body because of the stress of life. It's not being dealt with. And reduction of persistent organic pollutants and increase of enzymatic activity and the decrease of sentient cells and gelatinous lymph and getting a free flow of the fluid within our bodies. That's a whole part of the enzymatic activity system, both in the digestive system and in the blood system. And so when I use a combination of things to passively remove persistent organic pollutants like chlorozyme, which is a chlorophyll, it binds heavy metals, or sulforozyme, which is a sulfur donor, which feeds the primary pathway for detoxification of the liver, but it also provides ample amount of sulfur, which anyone who's taken any kind of chemistry knows that almost every mineral will bind to sulfur. And sulfur is used to remove toxins and poisons from the body through the liver, through the cytochrome P450 pathway, and is also just required for uh, robust function of our elimination system. And so I use low dose chlorozyme, especially since COVID, with almost every client that comes in. And they may just take, and both of these, by the way, are important to be dosed in the PM because the activity of the liver and the elimination systems works overnight. And so the strongest time of the liver is from 3 o'clock to 5 o'clock in the morning. And so we put in things that get utilized in the PM at night. We put in sulforozyme, one chlorozyme, but do them for 6 months and see how you're doing, one a day. What do we take in the morning? We take our D3 in the morning and we take nitric oxide promoters in the morning. One of the things that I found incredibly helpful was that the Master Supplements D3 zyme with its astrozyme and its uh, cofactor digestive enzymes is one of the only D3s that I've ever given people that will move the blood level of D3, will move that needle in 30 to 60 days.
Mm.
All the other D3s, maybe not, maybe so. But D3 zyme, incredible. People who were not absorbing or getting a benefit from their nitric oxide precursors, in the main, a lot of them were Irish American, Irish heritage, English heritage, Scottish heritage, Northern Europeans. For whatever reason, I kept seeing this. So I asked one of my friends who was a pharmacist, an RPH, and an expert in nitric oxide and its physiology and written extensively on it. I asked two of the top people in the world about nitric oxide. Why do they need D3 and calcium metabolism? And it turns out that there is a pathway called calmodulin, and calmodulin modulates calcium to the liver and regulates the capability of the liver to produce nitric oxide. And it's a whole big fancy metabolic pathway. But if you are of strong Irish heritage and you have different health challenges and you want to measure your nitric oxide capability and you want to see what happens when you start using D3 with an appropriate nitric oxide supplement. Now, you guys don't have one in your line. I'm not going to mention another company. People can come to my website. They can go to, just they can find out about it. But um, the D3 very often minimizes the need for high doses of nitric oxide precursors, which in my estimation is a foundational molecule that should be robust in every human being. And it is hugely depleted in our population right now. And it is at the root of circulatory dysfunction, oral microbiome, digestive microbiome dysfunction, gastrointestinal microbiome, etc. And so in the AM, what I utilize are my systemic enzymes because by just the activities of daily living, including exercise, we break down tissue actively throughout the day. And so the inflammation created by eliminating broken down tissue is best served by such things as Enzyme, serapeptidase, the Therazine, which is another spectrum of systemic enzymes. You know them and have taught people about them far better than I. My contribution is when should I take these things? And there's the fact that we do things in harmony with our biology and the way our biology works is a great reason why we get the success that we do. So if I'm going to supplement a probiotic, I pick the one that's appropriate to the biology of that person. And I give it to them in the PM and we do it empty. Well, why do we do that? We find beneficial bacteria all throughout the body, not just in the gut. Okay. And this whole notion of leaky gut syndrome and all these other things, yeah, is there a reality? There is. But the microbiome is everywhere in the body. And when I see tissue healing, we find beneficial bacteria in the lungs, in the blood, in the tissue, in an organ. What are they doing there? Well, they're your cleanup crew. They have permission to go anywhere. They've got a hall pass. Nobody talks about the migration of the microbes anywhere they want to go because they just hop on the bloodstream bus and ride it to wherever they're needed. Beneficial bacteria and not beneficial bacteria are in a constant battle throughout our body. They
It's an
vie for
interesting
food.
premise. There's an
What's
interesting
that?
premise too that I've heard that when someone creates a dysbiotic environment, it's not actually that the microbes are the problem. The strains and species, if you will, of microbes are attracted to an area of the body that doesn't have enough energy to do its job. So they're actually coming to help, but we're looking at it in the wrong, through the wrong lens of there being the problem. But the reality is they're consciously put there because something ain't right.
You're absolutely correct. They are there by permission.
Yeah.
And that's why I said they get a hall pass.
Hmm.
They get invited. It's like, would you please come over here and clean this mess up for me? Because I'm out of enzymes. And the passive system is the enzymatic system. The active system is the microbial helper guys. Okay. So, in great part, dysbiosis is reduced by systemic and digestive enzymes.
Yeah.
Why digestive enzymes? Well, let's take an A blood type, for example. They are not good meat digesters. Okay. Um, I I don't try to make people nutritional neurotics by following strict adhesion to um, eating protocols. However, if you eat something and it doesn't sit well with you, don't do it again. All right. What are you doing it again for? Oh, every time I eat, fill in the blank, I get gas, I get bloating, I get sick, I feel tired. So don't do it again. Well, you think the next time it's going to be wonderful for you? Just stop eating that. Or find out if I take an enzyme or enzyme plus or whatever enzyme bandwidth, that doesn't bother me at all. I mean, you and I have gone out to dinner often enough to Brazilian steakhouses and other places that were where lions would have gone and laid down,
But
with
we
full
we put
belly,
these things to the test.
and we get there and set the jar of enzymes in the middle of the table, and as we're feasting on, you
Yeah,
know,
it's part of the appetizer
carnivorian
course.
stuff, okay, everybody takes an enzyme, and then we turn it from red to green again, okay,
Yeah.
and it sounds humorous, but the reality is we all need enzyme help, and at my age, almost 70, I'll be 70 in October. I take enzymes every night, every day. I finish my day with enzymes. I start my day with enzymes. Okay. My friend Dr. Marks, who was a great influence on me in biological medicine, he learned EAB directly from Dr. Boll and worked with him. He was huge with Wobenzyme, and we did enzymes for years and years and years. But now that we've gotten more sophisticated and have better delivery systems, I've long transitioned into US enzymes and master supplements as a as a my go-to um, line.
Well, Jeff, that was a masterclass in a variety of different things. Not only practical actions when it comes to supplement use, guidelines, perspectives. I love how you also link to the use of products with honoring the timing of the circadian rhythm, but also elucidating things that I think a lot of people skip over because, as you said, there's a lot of the influence of the flavor of the month in the world of health, especially for practitioners who are so busy, they don't have time to learn things. So what ends up happening is they get their upgraded in education from their product reps. And unfortunately, that's not necessarily a complete package nowadays. It's where we try to do our best not to align ourselves with an absolute, narrow bandwidth of philosophy or perspective. So I love to interview people from all different walks of life because the different perspectives offer different things for people to start looking into. Because it really is just a starting point. And I'm definitely going to try to twist your arm to have you come back on in the future to do more of a masterclass clinical presentation because people do really request these kinds of episodes. So to round it out, I want you to tell us a little bit more about where people can find you. If someone wants to learn more about what you're doing, learn your perspectives on physiology, your algorithms and your frameworks, if you will. You have a non-for-profit that you've got going to the dedication of biophysics. Why don't you kind of end off there? And we'll just say not goodbye, but we'll wait till the next time you come back on.
Okay, well, thank you. Look, back in 2007, I came back from major conference in Sunnyvale, California, and I had just been several months before at the Hohen Clinic, at the High Clinic in um, Braunwald, Germany, with Dr. Thomas Rau from the Paracelsus Institute and with Dr. Alexander Riftein, who developed the nerve express and telewave heart rate variability. And both of us, Dr. Rao and I, were lecturing to the European um, Society for Cardio Pacing and Heart Rate Variability. And we had a wonderful 3 or 4 day conference there. Came back, I went to another conference, and I came home. And after that experience, I met some people from the Fritz Popp Institute and from the German Institute for Biophysics. And I was talking to colleagues and friends of mine on their back porch. And when I came back from the conference in California, it was a 200-person worldwide invitational. And I was invited because I took care of someone who was at the highest level of both Microsoft and Apple and had executive burnout. And that individual flew in to see me every month for over a year and a half from Seattle and dedicated to regaining their health. And they said, you ought to start a nonprofit to because no one knows about biophysics based medicine. And I came home and we founded the American Institute of Biophysics. And we made it a thing and we did all the paperwork and we registered it and so forth and so on. And it sat there until about 2 years ago. Just never got legs under it. And as I get near the end of my career and after Greg passed, and I decided I'm going to devote the end of my life to um, putting up the information for the public that they know nothing about, they've never heard about, and for practitioners. And so we secured some funding from some generous clients. Um, we built a website and are building a website for American Institute of Biophysics. We have a scientific integrity committee that includes people from all over the world. Our chairperson is from Canada, a renowned retired professor from Trent University, Dr. Magda Havas, has accepted that role. And between us, we know quite a few people around the country and around the world who do biophysics based work. And we're creating a platform for information, training, and certification of such things as heart rate variability, PEMF, uh, how to use lasers, medical lasers, other forms of intervention and assessment, and just general information about the world of real biophysics, where physiology meets biology and where physics meets physiology and biology.
Mhm.
The influence of light, sound, photonic stimulation, uh, electrical stimulation. What does it do? How does it do it? Why does it work? What is it? What has been documented? This is a realm of biophysics. It's not looking at CRISPR and seeing how we can restructure other people's DNA. Biophysics is the interaction of living systems with the physical world. And so that's what American Institute of Biophysics is. You can go to aibiophysics.org, and that website will be up shortly, like really shortly, within the week or two.
Okay.
And my personal website is bioenergydoc.com, and that links to the information and the companies and the products and the things that we use in our day-to-day practice, and allows access to a lot of the informatics about how, when, why, and where to utilize homotoxicology, biological medicine. And I'm looking forward to um, this transition in my life away from patient care only into education and dissemination of not only my lifetime of information, but Dr. Greg Ellis's, Dr. Yuri Krohn, who has passed, incredible waveform physicist, world renowned in subtle energy and understanding the influence of physics to biology and human physiology, and a number of Steven Sinatra with grounding, and he was an integrated cardiologist who passed just 2 years ago. Steve was a close colleague. Stephen Haltewanger from Texas, MD, uh, incredible colleague and friend, close associate for many, many years, brilliant man, foundational leader with the Certified Clinical Nutritionist Group, IAACN. These type of people have left legacies behind, and very often their legacies have been taken out of their homes in wheelbarrows and thrown in dumpsters.
Mm.
A lifetime of work, a library of knowledge, gone when they were gone. Um, I'm not going to let that happen. And, you know, thankfully for you, coming into my life as, the junior associate, someone with an open mind and an even more open heart. Um, you know my heart and you know my desires. And should something happen to me, I know that you'll be one of the people to carry on the torch that I've lit, that people like Dan Clark have lit, and those have gone before me. Uh, and we're going to build the flame and train and teach a lot of people to change their minds about becoming consciously aware of their vitality and living a robust, healthy life. And I'm hoping that all the things that I practiced for all these years will serve me in good stead, and that I have 20 or 30 more years to be around on the planet and watch what's happening, because we are living in interesting times. And
That
I
is
thank you
a
for
true
the
statement.
opportunity to to come on and expound upon some of my beliefs and thoughts. And thank you very much for being my friend and colleague.
It's an
From the bottom of
absolute
my
pleasure,
heart,
Jeff.
God bless you. Thank you.
Thank you for coming on and sharing stories, wisdom, insights, knowledge, and even more. You'll be back. It's inevitable. And I think I'm one of the few people who has the ability to twist your arm both directions if that request is going to be fulfilled. But I hope that people have really taken the time to disseminate all of the information in this episode once you've listened to it, digest it. Yeah, I know you do see some people on a special case by case basis. If someone feels compelled to reach out to you, you can do so through the website. If you are a practitioner and you want to learn more about Jeff's processes, put on your seatbelt and your propeller hats, get ready to go because it's a fun time. And thank you all for listening as always. We will be back on the Following Your Gut podcast soon with some more great episodes. We appreciate your support as always, and have a great rest of your week, weekend, whenever it is you listen to this. Take care.